Hello, welcome to the program Health and Wellbeing, and I am Lois Apasambu. Today on the program, we will be focusing on a very important topic, malaria in pregnancy. Malaria is a life-threatening disease that affects millions of people worldwide, and pregnant women are especially vulnerable. According to the 2021 World Malaria Report, Nigeria has the highest number of global malaria cases, accounting for 27% of global malaria cases and the highest number of deaths, with 32% of global malaria deaths, which was recorded in 2020. Meanwhile, the National Center for Biotechnology Information says 58.1% of pregnancies are complicated by malaria in Nigeria. On the program today, we will be discussing how pregnant women are expected to manage malaria during pregnancy. But before we speak to the experts, here's the experiences of some women who had malaria while they were pregnant.
Actually, I went to the hospital because I was not feeling fine for some times. I took medicine before going to the hospital. When I get there, they did some tests and told me that I have serious malaria. Then they give me injection. I took injection and tablets. So after treating it, I went back home. I was still sick again. I decided to come here and register for antenatal. So when I came, they tested me also. They told me that I have few malaria. So when I came back home, after 2, 3 days, I now experienced blood coming out of my body. I went back to hospital. They said I should go and do scan. So I went and do scan. They said there's nothing happened to my baby. That as blood is coming out, there is no problem.
First time when I at the house, I dey sick, stomach pain, headache, and sometimes my body just weak. Sometimes my baby wey dey inside no dey kick. Na my husband carry me come hospital. We come do general test. Na they give us drugs for malaria. That's why I tell my husband make we come this hospital. We come do for checkup. Na they tell us say I get malaria. Sometimes it can affect the baby die, or it can affect me for my body too. That make dem no dey take anyhow drugs, except make they come the hospital where they dey do clinic, and they give them the drugs.
Yeah, I was feeling like my throat like yellow and very bitter. So, and I was feeling headache. So that is when I know that I had malaria. So, taking medicine is not advisable because they don't take anyhow malaria drugs in pregnancy when you are pregnant. So you have to seek for doctor advice before you can take any medication.
Hi everyone, here are some practical tips on what you should do to avoid breast cancer.
Examine your breast on your birthday of each month. For instance, if you're born on the 12th of May, examine your breast every 12th of each month. Get familiar with the shape, the sizes, and the textures of your breast and nipple. Don't forget to check your armpits for lumps.
Reduce the intake of fried foods. The oils used to fry many fried foods release chemicals that can be harmful to your body.
Eat lots of vegetables. This contains the nutrients that your body needs to help fight off diseases.
Tooth and gum diseases have been linked to cancer, memory loss, heart diseases, dementia, and stroke. Make sure you brush at least twice a day, especially before you go to bed. If you can, floss regularly and have your teeth checked at least once every year.
Reduce your exposure to toxins by minimizing your use of hairsprays and deodorants containing aluminum and lead as much as possible.
Avoid smoking.
Exercise regularly, at least 3 times a week.
If you have babies, make sure you breastfeed exclusively for at least 6 months.
As women, you should avoid placing your smartphone in your breast pocket or inside your bra. Some believe that this would emit high levels of radiation which could lead to breast cancer and other forms of cancer. Secondly, you should avoid or limit your intake of highly processed foods, aka junk foods, as they contain toxins that are harmful to the body.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we would realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite.
This message is brought to you by Abuja Broadcasting Corporation, owners and operators of ASO Radio 93.5 FM Abuja, ASO Television DSTV Channel 392, Star Times Terrestrial Channel 127, Free TV Channel 507, People's TV Channel 285, and UHF Channel 38.
Welcome back, and in the studio today we have Dr. Echo Edet, who is the Assistant Program Manager Malaria at Breakthrough Action Nigeria. You're welcome to the program, sir.
Thank you very much.
And it's nice having you on the program.
Pleasure.
So, straight, let's talk about malaria in pregnancy. What are the risks of pregnant women, or what are the risks that pose pregnant women having malaria during pregnancy?
All right, thank you very much for that question. Before I go into that question, I just want to inform that Breakthrough Action Nigeria is United States Agency for International Development flagship project, social and behavior change project. We aim to, ensure adherence to priority malaria behaviors, by the general public. So we know you've already established that malaria is an important, public health condition in Nigeria. Of course, it's responsible for 27% of cases globally. That's Nigeria accounts for 27% of cases globally and 31% of deaths globally. So malaria is a big problem in our country. So it's much more a problem in pregnant women and children under 5. But I understand that the focus of our discussion is pregnant women. So we'll stick to that. So first of all, what happens in malaria is that because the malaria parasites break down blood cells, they can cause maternal anemia. All right, and when they do that, they also predispose the child to other problems. Now, we must also know that there can be transplacental transfer of malaria parasites, which means that the fetus, the unborn baby, can be affected by malaria. And when they do, they have problems like intrauterine growth restriction, where the baby is not growing as they ought to. And of course, we can have issues, with preterm or premature delivery. We can even have a situation where the woman has a stillbirth or loses the pregnancy to malaria. So malaria is a serious problem in our country and a serious problem among pregnant women.
And because we're in this part of the world, we're used to malaria. So many times people are ill and then the person says, this thing no go pass malaria, because you just feel this is how my body tells me or this is how I feel.
Yeah.
So when it comes to pregnant women, just like you said, there's a lot that is at stake, the mother, the child, and all of that. So for mothers, it's very peculiar, expectant mothers, it's very peculiar because they're pregnant and at that time their body isn't even theirs. So there's so many things going on with the body. How will pregnant women know that what it is that they're feeling is malaria, and they should go to the hospital, and not just it being one of those morning illnesses, that just comes with pregnancy?
Okay, so one straight message out there is that you shouldn't take malaria as a common disease condition. Malaria is not common. It, in fact, has serious complications. So to know someone who has malaria, first of all, you have symptoms like fever, and this fever is usually low grade and it's intermittent, which means that the person may feel warm, feel feverish now, and then after a while, the woman is okay, and then after a while, she experiences the feverish condition again. Besides the fever, of course, there could be things like headache, body pains, joint pains. But just to say that a lot of disease conditions can present as malaria, all right, and they can present with fever. And that is why our organization and even the National Malaria Elimination Program encourages people who develop fever to go to a health facility, run a test, and then confirm it's malaria and get treated, Okay.
Yeah. So what are the treatment options for pregnant women? Because I understand it's peculiar, treatment options for pregnant women are peculiar than those for normal people that are not pregnant.
Okay, yeah. So I think I'll start with the preventive measure, which is one of the priority malaria behaviors that we're preaching to people out there. And one of it is called intermittent preventive treatment in pregnancy. And we do that with a drug called sulfadoxine pyrimethamine, what we commonly know as Fancida. And that drug is basically to prevent, malaria in pregnancy. And so that's the first stage. And then, of course, the new recommendation now by WHO and even the national guideline is that if any pregnant woman is tested and confirmed positive for malaria, she should be treated with the full course of artemisinin-based combination therapy. That's the malaria drugs that you know. And these drugs have undergone trial and we found that it is safe in pregnancy. So there's no excuse for not treating malaria in pregnancy.
Okay, so because this takes me back to treatment for malaria, from some of the women that were interviewed, asking of their experiences, one of the things they constantly say is you're told not to, and yes, treating yourself is not, whether you're pregnant or not, treating yourself is not right, But one of the reasons why they say don't treat yourself is, okay, there's some medications that are not necessarily safe for you as a pregnant woman, malaria medication. So I'm thinking, if you're saying, if you're pregnant and you've been tested positive, you can be treated with the full dose of malaria. So what kind of drugs or malaria drugs are not safe for pregnant women?
Okay, what kind of malaria drugs? So what I know and what we advocate is the drugs that are recommended by WHO and our national guidelines. And that's what I mentioned, artemisinin-based combination therapy. And some of them are things like artemether, lumefantrine that you know of, and that's pretty much safe in pregnancy. So we advocate that it is treated that way. And of course, pregnant women shouldn't take drugs on itself. Self-medication is a big problem, So first of all, you don't know what you're treating. So it's really dangerous to treat without a doctor's prescription. So it's important to treat malaria in a recognized health facility, and the doctors know the recommended medications for the pregnant woman. So I don't think it's even right to put it out there, the different drugs people could take, because there's a temptation that the pregnant woman could want to buy drugs like that or any other drug, to treat themselves. So it's important you get tested in a health facility and treated by, a qualified medical practitioner.
Okay, so apart from medication, now talking about prevention, apart from medication, what other interventions are there for pregnant women to prevent them from, having malaria?
All right, so generally there are different preventive measures for malaria. We have the insecticide-treated nets, where we encourage pregnant women and, in fact, every other person out there to sleep inside insecticide-treated bed nets, every night all year round. So for the pregnant woman, of course, you have to consistently sleep inside insecticide-treated nets. The other one was the intermittent preventive treatment in pregnancy that I mentioned. And of course, the other general measures will perhaps be indoor residual spraying. Some people use insecticide sprays, and then you ensure you clean your environment because, to avoid breeding of mosquito around your neighborhood. But for pregnant women, the two key things we emphasize is that intermittent preventive treatment in pregnancy and sleeping inside insecticide-treated nets every night.
Okay. So for testing, let's talk about testing. How often should pregnant women generally, be tested for malaria?
Okay, so for malaria, we don't really encourage people testing like as often without any indication. Of course, we recommend people to test for malaria when they have symptoms suggestive of malaria, including fever. So when the pregnant woman is unwell, it is important as soon as possible that the woman proceeds to a health facility, complains to the practitioner, who will then recommend certain tests, and most likely that test will include a malaria test. Health workers are trained to identify certain disease conditions, at least make clinical suspicion, and then ask for recommended tests like malaria tests. So we encourage the pregnant woman to always ask for tests. We don't say do it every 2 weeks, do it every 1 month. That's not the recommendation, really.
Okay. So I know that as the Assistant Program Manager for Malaria at
Assistant Program Officer at the USAID Breakthrough Action Nigeria, you most times have times where you go on the field, and you meet women that are pregnant, some that have had malaria. I'd just like you to explain to us, because sometimes, the audience would like to know how deep it is before sometimes they decide to take action. I'd just like you to tell us, like, the worst case of, a woman with malaria that you had seen and how bad it had affected her and her child. Okay, so first off, we've had situations where a pregnant woman had a stillbirth, all right, and there was nothing like antenatal care and all of that. And then suddenly the woman developed fever and some other disease and never presented to the hospital until, the main reasons came for her to be in a health facility. So, of course, she had a stillbirth. We've had issues where people had miscarriages that were linked to malaria. So it's a big problem. But for our program, what we do is we do community-based, amongst other, of course, approaches, we do community-based social and behavior change activities, what we call SBC activities. And some of those activities include compound meetings, household visits, community health dialogues. Now, these vary depending on the state. For northern states, we use our compound meetings to reach specifically women. And when we reach them, one of the things we encourage is for them to present early to health facilities for antenatal registration, and of course, for uptake of the intermittent preventive treatment in pregnancy. And we do that in all our implementing states, just to ensure that the women are receiving the care and are getting tested and treated for malaria as soon as possible. And let's note that malaria can, progress quickly. If you don't do anything within 24 hours to 48 hours, whoever has malaria, including the pregnant woman, can go on to develop severe malaria, and that can be, very bad for the mother and the baby.
So when you talk about 24 hours, I'm just like, it's not the same malaria that we have,
Yeah.
And so it just takes us back to generally now, not just only for women. What would be your advice, to people out there concerning how they take care of their environment, looking at the mode of transmission and how people, contract malaria? What would be your advice to people out there?
Okay, so first, take care of waterlogged areas, clean your gutters, because these are the likely places where breeding would occur. That's very important, So that's it for the general. That's what we would advise everyone to do. And of course, when you have a fever, please get tested, because fevers could be caused by many other conditions, including malaria. So it's not safe to assume that the fever is from malaria alone.
Of course, it's not safe to assume that every fever is a malaria, especially for pregnant women out there. Thank you very much, Dr. Edet, for taking out time to be here with us on the program. We sincerely appreciate your presence. And we hope when we call on you again, you would still make out time to be here. Thank you very much.
Thank you.
So that's the size of the package today. But do join us next week, Thursday, by 5 p.m. for more information on health and well-being. And for questions, feedback and comments, you can reach out to me via my social media handles that are scrolling right now on the screen. Do stay safe.